Hello everyone. So now today's topic will be fabrication of occlusal rims and putting it onto an articulator. Now how does this occlusal rim come into picture? The first very important step that we did initially was making a primary impression of the patient. When the primary impression was ready, then we moved towards the secondary impression. And how did we go about it? We did the border molding, that is peripheral sealing, with the help of green stick compound or with the help of polyether. Then we went ahead with the wash impression with zinc oxide eugenol paste or light poly. Then ahead we made the master cast, which we obtained from the secondary impression or the final impression. Then once the master cast was ready, then we will fabricate the occlusal rims on the particular master cast by putting a temporary or a permanent base plate. So now let's see the steps followed for occlusal rim. For that, let us know what exactly occlusal rim is. So according to GPT-8, it says everything in the definition that occlusal rim is the occluding surface which is built on the temporary or the permanent record base for the purpose of making maxillomandibular relationship, that is a jaw relation, and also to arrange the teeth on that particular wax rim. So that entire wax rim which is made onto the temporary or a permanent denture base on the master cast specially is called the occlusal rims. So what are occlusal rims fabricated for? So we know occlusal rim is fabricated for three different reasons. One is to do the jaw relation, that is a maxillomandibular relation. Second, it is fabricated to arrange the teeth over there, the anterior and the posterior acrylic or the porcelain teeth which will be coming over the occlusion surfaces, that has to be arranged. Where has that to be arranged? On the occlusal rims. So that is the main purpose of fabricating any occlusal rim. So coming up to the factors which are controlling the form of an occlusal rim. Now what will decide how should be our occlusal rims? Now the factors, the number one factor is which we are coming through from years together is our teeth should be on the ridge. Really, is that so? Yes, it is. The teeth should be in the place where the original teeth was, not exactly onto the ridge. Why is that so? Because of proprioceptive responses by the patient. That is what that does mean. Proprioception is the response, the stimuli which the patient has inbuilt in himself or herself for years together due to the present teeth. Now when the teeth are not there, when the patient is edentulous, so in that particular place, whatever we are going to give the teeth should be in the original place of the teeth and not exactly always upon the ridge. Now where exactly it should be? It should be somewhere near to the neutral zone. Now again a new term. What is neutral zone? Neutral zone means it is that particular space which is equally supported by the pressure of the tongue on one side and the cheeks on the other side. So when the pressure, vector pressure of the tongue and the cheek equalizes, that particular region will be called as the neutral zone. So the teeth arranged in the neutral zone is the best way to give away a denture teeth to a patient. Coming to the other factors which will be controlling the occlusal rims, yes, of course, the size and the shape of the arch. Now if my arch is U-shape, my occlusal rim will also be a U-shape. If my arch is a V-shape, the occlusal rim will also be somewhere near to the V-shape. Also, it will be determined by the patient to patient. Likewise, if a patient is having short lip length, we all knew what is lip length, that is from the distance from the nose subnasally to the lower part of the mammalian border. So if this lip length is smaller in some patient, that means the visibility of the wax rim will be more, the visibility of the teeth will be more, so that has to be fabricated like that. If the patient has a long lip, or somewhere you say an edentulous patient aging 80 years or so, where the neuromuscular control is totally gone away. So in those patients, what will happen? The flaccidity and the tonicity of the muscles will be gone. So in again that case, these will droop down. So once these areas are drooping down, that means it is covering the maximum part of the wax rim. So again, that will decide the length and height and width of the wax rims because of the visibility factor, aesthetics factor which comes into picture. Now coming up to the dimensions of maxillary and mandibular wax rims. Is there any ideal dimension for any maxillary and mandibular wax rims? And if there is any ideal dimension, will that be same for patient to patient, or will that vary from patient to patient? Ideally, any wax rim for maxillary, say for example maxillary, what should be the length of the rim that has to be prepared from the sulcus depth? So it is 22 mm in the canine region or the canine cuspid region, cuspid eminence region. 22 mm from where? From the sulcus depth to the canine cuspid region. Where should be the posterior region height measured from? Again, from sulcus depth to the posterior molar region, it should be around 18 mm. Now this was from the sulcus depth, so the length is going to vary when we are going to measure it from the ridge, crest of the ridge. So from crest of the ridge to that of the cuspid region, it should be nearly about 10 mm, and that in the posterior region should be around 6 to 8 mm. Now coming up to what should be the width of the occlusal rim. In anterior region, as we all know, our maxillary teeth, anteriors are the incisors, the canines, the laterals are smaller in the buccolingual width and more in the mesiodistal width. So, buccolingually we do not need more space. So, 4 to 6 mm is fair good enough space for a width of the maxillary anterior region. Whereas in the case of molars, premolars, the width buccolingually is more. So for that to accommodate in the wax rim, we need around 8 to 12 mm space in the posterior region. So that will decide the width of the anterior and the posterior region wax rims. Coming up to the mandibular occlusal rim. Similarly, in mandibular occlusal rim, we will see from the sulcus depth to the cuspid eminence region will be around 18 mm. And posteriorly, will there be any measurement? No. For every patient, the retromolar pad is going to decide the posterior height of the wax rim. Now, how is that going to decide? So, in your cast, when you mark the retromolar pad, which will be round in shape, and you divide that into 3 sections, the upper part, the middle part, and the lower part. So, your wax rim should be till the 2/3 of the retromolar pad. Actually, keep your wax rims to middle of the retromolar pad, because the teeth that you're going to arrange will be at least 0.5 mm above the wax rim in the posterior region. So that will come along with the 2/3 of the retromolar pad. So once you keep it to the middle, little more height, that will be 2/3 of the retromolar pad. So our wax rims should be ending to middle of the retromolar pad. Coming to the other section, that is the width. So width of the retromolar, width in the posterior and the anterior region will be again 4 to 6 mm in the anterior, 8 to 12 mm in the posterior region. What should be the length in case of the crest of the ridge to that of the height of the wax rim? So again, the crest of the ridge in the anterior region, it should be 6 to 8 mm. Posteriorly, it will be depending on the retromolar pad. Now, why is it necessary to keep our wax rim to 2/3 of our retromolar pad? This is a very important question and an important concept to understand. In retromolar pad, that is an area which is inclined. So anything to be arranged, a teeth to be arranged in an inclined plane. When this is an inclined plane, you arrange your teeth over here. So the force which is acting from the mastication is not going to fall perpendicular to the long axis of the teeth. Henceforth, it will not go perpendicular to the bone underlying. Henceforth, it will be detrimental and also will cause tilting and torquing of the denture. So yes, any area which has got slope, we will not arrange our teeth over there. Similarly, in case of maxillary, where tuberosity region, it has got slope. So what we are supposed to do? We are supposed to mark the tuberosity region and put a line across the tuberosity region to that of the cast. And our wax rim, the posterior limit of our wax rim should be ending in that particular region. Because again there is a slope. So again if we arrange our teeth over there, what is going to happen? The forces are not going to be inclined. It's not going to be in the perpendicular direction. Rather, it will be in inclined direction. So whenever the force is in inclined direction, it is detrimental for the underlying bone, which will cause resorption of the bone and also teetering and tweeting of the denture base. So these were about the dimensions of the maxillary and mandibular wax rims. Of course, every patient will have different. This is an ideal which is to be kept in the mind, making patient to patient it is going to vary, so that will be decided intraorally in the mouth. So coming, what are the techniques of fabrication of the wax rim? There are three different techniques that you can fabricate the wax rim with. One is a rolled wax technique, which is commonly used. One is a metal occlusal rim former, which we get in the market, which is the wax is to be flowed in that particular region, the metal former that we have, and your wax rims are ready. It's like, and you have also got in the market in these days for easy work of the dentist, there are preformed occlusal rims. I prefer rolled wax technique, or anybody in today's day-to-day life, everybody uses rolled wax technique. How do we do that? So coming up to rolled wax technique, you take a wax sheet, a modeling wax sheet, which is in the height of, in a width of 1.5 mm. Now what we do is, we heat that particular wax rim, we start heating the wax rim from one end, making it flaccid, then we roll the wax rim. So once we roll the wax rim, then we make it in the shape of the arch which is present in front of us in the cast. So that will decide the shape of the wax rim. Now how much height is desired, that will decide how much rolling you're going to do. So the amount you're going to roll your wax will be the height that is going to increase. So you cut your wax rim after it is rolled in the desired length and the desired height, and you adapt it over the temporary or the permanent denture base. This is what exactly is the rolled wax technique of fabrication of occlusal rim. Now once rim is fabricated, once the rims are fabricated, once the jaw relations are made, maxillomandibular relations are recorded, then we are supposed to transfer it to the articulator, right? So that is the main motto. So to transfer it into the articulator, now when we have the master cast and we have a temporary record base on that, we have a wax rim over that. Now there has to be something, some guidelines, some references which are going to dictate that how are we going to put it into the articulator. So we are supposed to mark certain lines on the master cast, based on what we are going to do the articulation of the cast with the help of occlusal rim and the lines marked over it. So where are the lines to be marked? The first thing that we need to keep in mind is the incisive papilla that we have. The distance from the incisive papilla, if you see the middle of incisive papilla to that of the edge of the central incisor, maxillary I'm talking about, will be around 8 mm, 6 to 8 mm. Distance should be there between the incisive papilla and that of edge of the maxillary central incisor. That is one guideline. So once we draw a horizontal line from middle of incisive papilla passing through the canine eminences, that line is also known as CPC, that is canine papillary canine line. So from one cuspid eminence to the incisive papilla to the cuspid eminence will be a straight line which is called CPC line. From that it should be measured, that is one line which we drew on the cast that should be extending to the cast, down of the cast in the land area, also in the artistic area. Then the second line should be from the cuspid eminence to the middle of the ridge which is present. A straight line with the help of your scale should be drawn till the back of the maxillary tuberosity, and that will be extended again down the artistic area of the cast. Has to be done simultaneously on both the sides. So we have three lines marked CPC, one perpendicular line to back, one perpendicular on the right side. So left and right two lines and one CPC line. This is all about the maxillary lines that you are supposed to mark. What about in mandible? In mandible, we have already marked the retromolar pad. We have done 2/3 of retromolar pad. So extend that 2/3 line to the cast. So that will be the guideline till where our occlusal rim should be in the posterior region. In the anterior region, again the same, we will draw a cuspid eminence line to the posterior region with the help of scale, and that we will again extend below the cast in the heel area. Below the heel area we will extend the line. So there will be again two lines in case of mandibular cast. So this is now we have the cast ready with the help of occlusal rims and certain lines which will dictate its position on an articulator. So now articulator, there can be any type. We already spoke. It can be non-adjustable, it can be adjustable, it can be semi-adjustable articulators. So and it can be also fully adjustable articulators. So based on all these types of articulator and the markings that we did on the cast, we are going to articulate it with the help of occlusal rims, which is done after jaw relation to simulate, when we do not have the patient, to simulate intraorally what is the patient's relation intraorally when the patient is not there in the help of the lab works. So thank you.